Hi, I'm Dr. Joel Yaffa, family doctor, and your chairman for the BHRT World Summit. The BHRT World Summit is an internet seminar whose purpose is to bring to as many people as possible the information of the BHRT approach. Today, we are fortunate to have with us Dr. Eldred Taylor, MD. He's a board-certified obstetrician-gynecologist. He was trained as a conventional obstetrician-gynecologist, but he saw many inconsistencies in the way medicine was being taught and practiced. He wanted to know how come he was told to disregard the blood tests of hormones while he was in his residency program. Maybe he thought that blood wasn't the best thing to be testing for hormones. He also questioned why chemical synthetic hormones were given for patients that were different. Some were overweight and some were skinny. Some were taking lots of medicine and some were taking none, and yet the same synthetic medicine was given to everybody. Also, he wanted to know why a chemical hormone medicine was given and we weren't really regarding the different hormones that we all have. Instead, we were being prescribed medicines that our bodies never saw before to correct problems of hormone imbalances that could have been done differently. So he went back to his OB/GYN textbooks and he reread them and he realized that the BHRT approach was what he wanted to practice. He studied it, he practiced it, and now he's written a book called Are Your Hormones Making You Sick? It's a very popular book. He practices with BHRT in his Atlanta, Georgia office, and he spends a good amount of time flying around the world teaching doctors how to do it right. We're very fortunate that Dr. Eldred Taylor will be talking to us about the connection of the gastrointestinal tract along that has to do with our hormones. Thanks very much, Dr. Taylor, for being with us.
Thank you for having me. I appreciate the opportunity.
Okay. Is there anything else you wanted to add to the introduction about who you are and what you're doing nowadays?
No, I think you covered it very well. I appreciate the introduction.
Okay. So maybe we could just start off and describe a little bit what is the digestive tract, the different parts of it, and how in the world is it connected to the hormones?
Well, as you noted, this has been a long journey. This has been about a 10-year journey for me. And initially, I was very interested in bioidentical hormones. As you said, I kind of went down that pathway and discovered a lot of things that I didn't know. And the last time we were together, we talked about cortisol and stress. And that was my focus for a long time, how the hormones were connected with stress. But then as I continued down this journey, I began to understand how stress is not always emotional. Stress can be due to physical factors and physiologic factors. And the most common opportunity for your body to have to deal with something that could be dangerous or stressful is by what we put into our mouths every day. What I began to understand is that due to all of the processed foods and the chemicals and the dyes, the GI system is under extreme pressure to filter out everything that you don't need, and in order to be able to absorb what you do need. So it's very important to understand the gastrointestinal system, and if we want to talk about it, you're asking me what the different parts are. Well, it begins in your mouth. Well, I'll tell you, it really begins in your brain. Your brain will decide what you are going to eat, and if your brain determines that you have certain deficiencies, and I was trained as an OB/GYN, if a pregnant patient has a deficiency in iron or minerals, the brain will almost force her to go and eat dirt. It's called pica, in order to get the iron and the minerals. So the brain is the first part of the digestive system. if you find that you're depressed, your brain will crave carbohydrates because it's a way to increase neurotransmitters in the brain. So digestion starts in the brain, and then the mouth begins to break down different foods, carbohydrates, and also the mouth is the beginning of your immune system. And your immune system protects you against outside dangers, which can be found in the food. And so you have to have a properly functioning immune system, beginning in the mouth, to kill certain bacteria, to break down certain chemicals so that you can excrete them either in your feces or in your urine. So then after that takes place, the esophagus is the little tube that connects the mouth to the stomach, and in the stomach there's acid, and that acid is very important to break down food, and also the acid is very important to break down proteins and to kill bacteria. The acidity in your stomach is important, and there's so many people who are on antacids and who are on what we call proton pump inhibitors that decrease stomach acid. And it may get rid of your heartburn, but it can leave you open to undigested food, and also allowing microbes that should be killed in the stomach to pass through into the lower portions of your intestines. Now, also your pancreas makes digestive enzymes. If your pancreas is not working properly, you don't have proper digestive enzymes, then you don't properly digest your food before it goes to your small intestines. Okay? In your small intestines, they're supposed to absorb nutrients, and they're supposed to get rid of what is not a nutrient. All right? If undigested food is passing by there, passing into the small intestines, and it's not digested, the intestines will slow down, and it will cause you to bloat. And it causes pressure on the small intestines to have to digest the food, along with absorbing what it shouldn't have and getting rid of what it shouldn't. So if your small intestines are continually under that pressure or stress, it can begin not to work very well. And if it is under stress, it disrupts cortisol, and cortisol disrupts all of your other hormones. So then finally, the large intestines, you're supposed to get rid of all of the things that you should be getting rid of. But if higher up in the GI system things aren't working, you don't have proper bowel movements. You should have 2 or 3 bowel movements a day. If you're only having 1 a day or 1 every other day, all of the toxins that your body was trying to get rid of, they get reabsorbed because they're sitting in your bowels so long. Again, that's another pressure. You went through all of this. Trouble trying to get rid of these toxins, and now they're sitting in your bowel and they're being reabsorbed, and your body has to do it all over again, which is another stress. And as we talked about in the previous internet lecture, when you are under stress, it kind of turns off all the other hormones, keeps them from functioning properly. So that may have been a long way to get to it, but if anywhere along there the digestive system, things aren't working appropriately, it leads to cortisol issues, and then the cortisol issues lead to hormonal issues. So it's really about peeling back that onion until you can get to the basic cause of the problems. And that's why sometimes it's most noticeable as a hormonal issue. But when you really peel back the layers of the onion, it might all start from what you're putting in your mouth every day.
Can you elaborate a little bit more on the cortisol or on the stress aspect? That's when a person has stress, they're anxious when they're eating, they don't have enough time to eat when they're eating, they're rushing, they're thinking about something else, they're doing another project, they're not sitting down. How does that actually affect our digestion?
Yeah, well, what happens, I told you, digestion starts in the brain, and the brain has to be relaxed. I think last time we talked about parasympathetic and sympathetic. Sympathetic is that alarm system. The parasympathetic causes you to be calm. Your parasympathetic system has to be working for you to be able to digest your food. So you have to be relaxed. That's why it's important to sit down before you eat, to relax. One of the things about saying grace or a blessing over your food is to get you to relax, kind of forget about what's going on, to turn off that sympathetic nervous system, turn off the alarm, and allow your parasympathetic system to work properly. Now, when you're relaxed, you begin to make digestive enzymes, which I told you need the digestive enzymes to break down the food in the stomach. You start to salivate. The saliva in your mouth helps you to break down certain carbohydrates. So you're exactly right. If you are not relaxed, allowing the saliva to work like it's supposed to, the immune system to rev up so they can protect you against certain additives to the food and certain microbes so that your immune system can work properly. If you find that you're not making enough digestive enzymes, you're right. Now you haven't digested the food properly in your stomach and in your mouth, and now you're putting pressure on the intestines to do the work that should have been done earlier in the GI system. So it is important to sit down, try and forget about whatever problems you had during the day. Focus on your family. Focus on good things when you're eating, so the parasympathetic system can work to its fullest, and you can turn off that alarm system for a few minutes.
Now, all of that is documented, right? It's all been measured, and we can all see that. That's not just a nice thing that we hear from our mothers. Relax. We're not in a rush. Eat slowly. Chew your food. That's all medical knowledge that we know. Is that right?
Oh yeah. I'll tell you the best example is that Pavlov's dog. If you don't know what that is, for the people who are listening, with Pavlov's dog, what they would do, this is a psychology experiment, they would ring a bell, and after they ring the bell, a few minutes later, they would put out food for the dog. And if you did that over and over again, what would happen is that every time you rang the bell, the dog would begin to salivate and make digestive juices, preparing to eat. So the signal of the bell set off this series of incidents, or series of digestive processes in the dog, whether there was food in front of the dog or not. So the signal signaled the brain, the bell signaled the brain of the dog to salivate and make digestive juices, and that's what happens with us. If we send the brain a signal that when we sit down and that when we relax and when you smell food on the stove or whatever, or on the table, that it prepares you for this food. It allows insulin to be made. It allows the digestive juices to be made, so you are ready to digest the food when you eat it. If all of a sudden you run in the house and stuff some food in your mouth and you run back out, your digestive system hasn't properly prepared for the food, so therefore the food is not digested properly, and that whole system has been disrupted. And again, you do that on a regular basis, it is a source of stress and abnormal cortisol production.
I'm really glad that you explained it that way, because we all know that we're supposed to take our time and sit quietly and eat slowly, but now knowing the medical reason that our bodies aren't really prepared for digestion, we won't be able to get the nutrients from it. We may even cause ourselves to become malnourished or overweight because of our eating in an improper fashion. So I'm glad that you explained that. What about the acid in the stomach? I'd like you to explain why taking those acid inhibitors are really not in our best interest.
Yeah, antacid and proton pump inhibitors, they decrease the production of acid in the stomach. Okay, two things: the cells that make acid, they also do they do three other things. One, these are called parietal cells, and they make something called intrinsic factor. And when you shut down these cells, not only do they stop making acid, but they stop making something called intrinsic factor. And intrinsic factor allows you to absorb the vitamin B12. So if the parietal cells are totally shut down, you don't make this substance called intrinsic factor, and you don't you're unable to absorb B12. And we all know that B12 is important for energy. B12 deficiency can cause fatigue, and that may be caused by you taking the acid inhibitors, the proton pump inhibitors. The acid in the stomach also breaks down proteins, and we all know that proteins are needed in order to build muscle, and you make those from amino acids that come from proteins. But what may be even more important in this day and time, and which is also associated with this stress, is that amino acids are important in making something called neurotransmitters. And neurotransmitters, what it simply means is amino acids are needed to make these chemicals that transmit messages from one cell in the brain to the other. And so these neurotransmitters are important for your concentration, for your memory, for your mood. You may have all heard of serotonin that helps with depression. All of those are made from amino acids. So if you're taking proton pump inhibitors and you're not making acid in your stomach, you cannot break down proteins into amino acids, so it can lead to a deficiency of neurotransmitters. If you have a deficiency of neurotransmitters, you're going to have trouble concentrating, remembering things, having trouble with depression. You can even have trouble with sleep. So something as simple as trying to get rid of heartburn can lead to all these other problems. The other important thing that happens with acid, or the function of the acid in the stomach, is to kill bacteria. We all know that what we eat is not sterile. It has bacteria, it has chemicals, it has all of these additives in there, and these bacteria need to be destroyed. The acid in the stomach is there to destroy some of these microbes. If you decrease the acid in the stomach, it's going to allow some of these microbes to survive the stomach, and now when it goes lower down into the intestines, it causes something called dysbiosis, or bacterial overgrowth. The normal bacteria in your GI system does a lot of good things for you. We say it's a symbiotic relationship. It can make vitamins for you, help you with constipation, help you to make essential fatty acids. But when you have these microbes that should have been killed in the stomach due to the acid going down into the intestines, it can cause bacterial overgrowth. And this bacterial overgrowth, now you have these bacteria that shouldn't be there, and they disrupt the function of the normal bacteria, and they can cause significant problems. So, just doing something simple as taking the purple pill can lead to all types of other issues that you might be unaware of.
You know, I hope that the drug companies aren't listening to this, because you may have given them an idea that when they give out that purple pill against heartburn, that they'll include also an antidepressant, so they'll save you time in treating your depression, because they know that the acid being inhibited is going to lead to protein deficiency, amino acid deficiency, and inability to make the neurotransmitters. So that's part of the way that this whole medical system of taking care of one problem leads to another problem. So seriously, I wanted to ask you, why do people get heartburn, and how can we avoid it in a healthy way? So far you told us relax before you eat, and eat slowly and properly will get all that stuff going. But there must be more to it, because lots and lots of people are suffering from heartburn.
Well, you know, one thing when you're under stress, a couple of things can happen. One, heartburn can happen because you have a laxity of the little sphincter that separates the tube that goes from your mouth to the stomach, so acid will reflux back into it. Now, another thing that can happen is that when you're under stress, food stays longer in your stomach. So because it's staying there longer, the acid is there longer, it's more likely for it to reflux. But now, one reason why it may be staying longer in your stomach may not be due to too little acid. It may not be due to too much acid. It can be due to too little acid, because the acidity is already down, it's having to stay there longer, there's more time for you to have the reflux. Surprisingly, that a lot of patients that you can treat heartburn, a way you can treat heartburn is actually by increasing the acidity of the stomach, along with increasing the amount of digestive enzymes. if you're able to more efficiently break down the food, it stays in the stomach longer, and so therefore you have more opportunity for you to have the reflux. If you are not under the stress, you relax, it allows for peristalsis so that the food leaves the stomach more quickly. The fact that you're relaxed allowed more acid and more digestive enzymes to come in and handle it more quickly, and therefore it leaves the stomach sooner. The fact that it stays there, we don't have enough acid, we don't have enough digestive enzymes, it causes this to lead to irritation. So it sounds kind of paradoxical, but a lot of patients with heartburn can benefit from increasing the acidity in their stomach. And one simple, like you said, like one of these grandmother's solutions is taking apple cider vinegar with your meal to increase the acidity, and that takes away heartburn in a large majority of people. That, along with digestive enzymes, can get rid of heartburn as well as the purple pill.
Okay. I thought apple cider vinegar was basic and is going to lower the acid.
No, it's acidic.
Okay.
It actually increases stomach acid.
Okay. How much should
and a lot of digestive enzymes will help
contain hydrochloric acid. You can actually take hydrochloric acid and increase the acidity of your stomach, and it can help with heartburn with several patients. Now, I'll tell you the ones it won't help with are patients who are on nonsteroidal anti-inflammatory drugs. The nonsteroidal anti-inflammatory drugs, what they do is they deplete the lining of the stomach. What happens is that when you're taking nonsteroidals, you decrease prostaglandins. Prostaglandins make a mucus coating of the stomach so that acid doesn't destroy the stomach lining. All right. When you take nonsteroidal anti-inflammatory drugs, you're unable to make that mucous membrane layer to protect not only the stomach but the rest of the GI system, and therefore you leave the stomach exposed to acid, and even a small amount of acid can cause irritation. If you increase the acidity, if you take the apple cider vinegar or if you take the increased acid and it actually causes the pain, and you're on NSAIDs, you need to get off the nonsteroidal anti-inflammatory drugs. But if that is not the case, a lot of times increasing acidity and increasing digestive enzymes can actually alleviate heartburn.
I'd like to clarify that what you were saying about non-steroidal anti-inflammatory drugs, that's a class of medicines that people are given to take away their aches and pains or inflammations in their joints from arthritis and other collagen vascular diseases. Do you think that the recommendations that people, men especially over 50, take an aspirin a day is then going to be detrimental to the lining of the stomach and the digestive system if aspirin is considered a non-steroidal anti-inflammatory drug?
I think what they're recommending now, which is a baby aspirin. I'm not exactly sure. I don't know what the study showed that, but there's no doubt about it that the non-steroidals like the Celebrex, the Motrin, all that, when they're taken in excess. I'm not saying if you take it for a week because you hurt your knee, out jogging or whatever, it's not a big issue. But there is a significant amount of the population that take these every day for those aches and pains. And if you're doing that, it's going to be a problem. Low dose aspirin therapy, I guess if you have a history of GI problems, then that can be an issue. But if you're taking it, to prevent cardiovascular disease, but I don't know necessarily if we need to be using that across the board if someone doesn't have a significant history of having cardiovascular disease.
Okay. You mentioned about the microbes and dysbiosis. Tell us practically what defines as the problem and where do we find it in the stomach and intestine? What are we talking about when we talk about dysbiosis?
Well, Dysbiosis. Symbiosis means that you live in harmony, and dysbiosis means that you live in disharmony. And what we're talking about is that there are actually about 70 trillion bacteria in your GI system on a normal basis. That you have a symbiotic relationship with about 70 trillion bacteria. Now, what happens is that those bacteria, we provide a place for them to live, and they actually do some good things for us. They actually help us to kill off bad microbes, bacteria that shouldn't be there. They protect us against certain parts of the environment, these xenoestrogens and xeno, when you say xeno, these man-made compounds and certain additives and pollutants that we are exposed to. They help us to make B vitamins and vitamin A and vitamin K. They help us to process foods into minerals and vitamins. They help with our immune system. They help the immunity of the gut, and the immune system, about 70% of your immune system is in your gut to protect you against all of these things that you put into your digestive system. So these bacteria do a lot of good things for us. Now, the problem is that stress can kill off the bacteria. Antibiotics, again, where we're trying to kill one bacteria, it's very hard to make an antibiotic that only will kill the bacteria that you want it to kill. It will kill some of these good bacteria. Now, if you kill off enough of the good bacteria, the problem is that these unwanted bacteria will come in and seize the opportunity. We call these opportunistic infections. And bacteria and fungi like yeast and Pseudomonas, these are these big long names, but these unwanted bacteria come in and take the place of the symbiotic bacteria. When this happens, you have bacterial overgrowth. One, we have a diminished capacity of the good bacteria to do the good things for us, and then we have these other bacteria that are pathogens that will cause inflammation. And inflammation is a big buzzword, even in the press, that we think inflammation leads to all kinds of things. Inflammation that we can really understand is that it can lead to arthritis and certain diseases like asthma. But we're also thinking that inflammation and chronic inflammation leads to heart disease. So the fact that we have these bacteria that's causing this low level of smoldering inflammation in the gut can lead to very serious long-term conditions, and even potentially lethal conditions like cardiovascular disease. So it's very important to understand that, and there are ways to test for that. You can actually take stool cultures, and they can look at what type of bacteria you have in your GI system. And the simple way to eradicate bacterial overgrowth is that you bombard your system with these good bacteria, because I told you the good bacteria will kill off, they will kill the bad bacteria. That's one of the functions that these what we call the intestinal flora, or the good bacteria, will do for us. And so you can take probiotics. And a lot of women have heard of probiotics because you can take probiotics to help with chronic yeast infections, vaginal yeast infections. But you can also take even larger doses of probiotics to restore this normal relationship of the good bacteria, and it replenishes this bacterial system, and it kills the bad bacteria, and it diminishes or eradicates the inflammation, which eradicates those long-term effects that we were talking about.
Okay, so we learned just now that if we take, if a person has an indigestion problem, it might be due to dysbiosis, which means that we could be having other bacteria, other viruses, other yeast type of particles, organisms in our digestive tract, which don't allow us to make the proper nutrients. They don't allow us to absorb our nutrients. They don't do certain conversion things inside. We can't get in proper B12. So many people are low in B12. they just take B12, but they don't realize that it's because of an absorption problem, and they don't attend to the real problem. So having a normal bowel of proper organisms is worthwhile, that a person should go after trying to take the probiotics from a very good quality to make sure that they can keep their immune system up. I'd like to tell you a very interesting anecdote that I experienced. I thought it was fascinating. I once found that there was a place advertising that they grow organic hens or organic chickens, and of course when they grow up they sell their meat as organic chickens. So I decided that I was going to go to this place to see how did they do it. Why could this place grow organic chickens instead of all of their neighbors in the industry having regular chickens, which means that the chickens are shot up with antibiotics and different steroids and all kinds of things to protect them so that they don't get different illnesses. So I went to this place and I saw this big, gigantic industrial chicken coop where there are, I don't know, thousands of chickens all resting on the ground there. And I said to him, how do you keep these chickens from getting sick? Everybody else is giving immunizations and all the other things. And he said, within 20 minutes of them hatching, he puts probiotics in their water and then gives them probiotics all the time as they grow up. And that keeps their own immune system so strong that they are resistant to illnesses. And then I said to him, do you give probiotics to yourself and your family? He said, absolutely. And it was truly a real life experience to see how much we can benefit from a proper digestive tract that has the right flora in it. I thought that was fascinating. Dr. Taylor, could you tell us a little bit about this phrase that we read about called leaky gut? What is it, and is it really an entity?
Well, leaky gut, what leaky gut means is that the GI system is allowing bacteria or particles or chemicals to come into the system that shouldn't be there. You have to remember that the GI system is really not a part of you. The GI system is separate. Its job is to filter what you need, amino acids, proteins, carbohydrates, all of that stuff. It's supposed to let that come in, and it's supposed to keep what you don't need to help make new cells and to restore brain function and heart function. Anything that's not important for those functions, they should be sent out the other end. They shouldn't be absorbed. Well, what happens is that under continual pressure of undigested food that gets into the intestines, that destroys those cells so that they're not a good filter anymore. All these chemicals that we are exposed to that can destroy the cell because we don't have proper bowel movements. It has more contact with the cells, so it destroys these cells that should be a filter, and now they're not a good filter anymore. So therefore, these chemicals, the undigested food, they end up causing these allergies. What happens is that your immune system, it makes antibodies to anything that's foreign to you. Well, the GI system is supposed to make sure that what's foreign to you doesn't get in. So now that it does get in, now you have allergies. And these aren't the allergies that you have that, like if you eat shellfish, everything swells up. These are what we call delayed allergies. And these delayed allergies cause these mild symptoms. They can cause aches and pains. They can cause fatigue. They can cause back pain, abdominal pain. All of these little mild, kind of nondescript type symptoms. And it all comes from leaky gut. So what happens is things that shouldn't come in get in, and things that should don't, and it leads to malabsorption. You don't get enough vitamins and minerals, and so you have fatigue. And so this is very important. And again, this leads to chronic inflammation, leads to a problem with cortisol. what you want to do is you want to test for this. A lot of times we wait until there's dire straits before we can identify this and do anything about it. But there's testing you can do. You can look and see how well your GI system is filtering these different particles. You can look at something called secretory IgA, which is the body's kind of armed guard. If you don't have enough of this secretory IgA, it's very likely that you have leaky gut. But again, like you were talking about the probiotics can help increase these armed guards so that it decreases the permeability of your gut, so you don't allow these things to, these different antigens or these certain chemicals to come in. So that's what we mean by leaky gut. And another issue that we hear all the time is irritable bowel. Well, irritable bowel means your bowel is irritated. Well, what is irritating it? Well, it can be these chemicals that you're taking, but it also can be the dysbiosis, the abnormal bacteria are irritating your bowel so that you have these bouts of diarrhea and constipation. And what is becoming even more prevalent is the incidence of parasites. And parasites are another one of these opportunistic infections that if you don't have enough of these armed guards and you don't have enough good bacteria, then these parasites can set up shop in your gut. And these parasites can cause all types of abdominal pain. Parasites like tapeworm can cause migraine headaches. They can cause actual seizures, these different types of parasites. And we usually think that parasites are due to unclean water that we may ingest when we go to a foreign country. But what we have to understand with the way immigration is now, there are a large majority of our population is now from these other countries. And in other countries, you can have a symbiotic relationship with certain parasites that may even help you, but because we're not have not been exposed to them, we don't have a symbiotic relationship with them. They actually cause us distress. And so you can test for parasites. You can treat these parasites. And instead of just saying that someone has irritable bowel or leaky gut, what you want to do is to examine the stool and be able to examine the GI system by looking at saliva and also stool, and it can identify some of these problems, and you can treat them early on and get rid of some of these symptoms that we may have been covering up with the nonsteroidals, the antidepressants, the certain GI drugs to help with abdominal pain. So it's very important to understand these terms that we're using, the irritable bowel, the leaky gut, and actually try and figure out what is the cause and treat those, and not just have a lifelong symptom relief.
Do you actually see results when you do stool testing of parasites in your practice?
No doubt. I'll tell you, my really office manager for like the first 6 years, she was a young girl, and she was constantly complaining of abdominal pain and constipation. She was taken off and going to the doctor and getting all kinds of tests. She had endoscopy, she had a colonoscopy. They didn't see anything. She kept having this abdominal pain. She had never been pregnant. She's 27, 28 years old. She went to a gynecologist, and they wanted to do a laparoscopy on her and thought that she may have endometriosis or may have an ovarian cyst, and they may have to remove her ovary. 27-year-old with no pregnancies. She told me that. I told her, don't let anybody touch her. We did a stool culture on her. She had, I can't remember the exact parasites, but she had parasites, she had bacterial overgrowth, and she had low digestive enzymes. What we did was we gave her digestive enzymes, we treated her parasites, we gave her probiotics, and 2 years later she hasn't been to the doctor not once. She knows that when she goes and eats a big meal, I think the first Thanksgiving she didn't have her digestive enzymes with her, and she could tell. She started having abdominal pain. But now she takes her digestive enzymes religiously. We've treated her parasites, and we've corrected her dysbiosis, and she has been doing fine ever since. So that is an example that I saw every day, and I know the difference in her. So this really does make a difference. There are a lot of holistic type medical providers who think that all disease enters through the gut. And the more I understand this, the more I believe it, because that is the easiest way for disease to enter, is through our GI system. And if we don't have a proper functioning GI system, we leave ourselves open to all of these environmental toxins.
I think it's so significant that the patients that have irritable bowel disease and taking all these medicines, whether they're steroids or other anti-inflammatories or medicines against acids, if they would just follow your instructions and do a comprehensive stool evaluation, then they would be able to get off of their medicines and be healthy. And they can't be healthy. I had a patient that had most of her intestines cut out over the years because nobody was doing those types of evaluations and treatments.
Yeah, it's funny how we accept these diagnoses, these vague diagnoses of irritable bowel. And all we have to do is ask one more question. Why is my bowel irritated? Okay, and you do a test and say, hey, look, is there anything in there that could be irritating your bowel? And you can do comprehensive tests to look at that. You say, okay, well, leaky gut. Okay, well, let's think about what could cause the gut to be leaky. Well, if you damage the filter, if you poke holes in your coffee filter, you're going to be drinking coffee grounds when you drink your coffee. So filters are very important. So if the filter in the GI system is not working well, then you're going to allow substances in that shouldn't come in. So you have to, but there are ways to repair it. But you can't repair it by taking drugs that get rid of the symptoms. You have to repair it by giving your body what it needs to make those new cells. And the GI cells are they're very sensitive. If you have known anybody who's taken chemotherapy, one of the symptoms, the side effects that you always get is nausea and vomiting. That's because chemotherapy kills rapidly dividing cells. Cancers are rapidly dividing cells, but the most rapidly dividing cells in your body are in your GI system. They turn over every 5 days. But if you are not taking in the proper nutrition for them to be able to turn over every 5 days, then you begin to have these areas in the gut that are not functioning properly because you haven't been able to replenish those cells. So that's why it's important to have proper nutrition, to be able to absorb these things properly, to absorb these nutrients properly, so that you can make these new cells so that they can be good filters for you. It's very important to understand these words that we seem to these names that we place on patients, this irritable bowel and leaky gut, and really understand what the origin is, and then try and treat it based on the origin of these problems and not just the results of the problems.
Thanks. Can you make a little bit more clear the point of having problems in our digestive tract affecting our hormones, like constantly draining our adrenal energy? I have patients that come in and they feel that all of their life stresses are okay, they go to sleep okay, and yet their adrenal glands are down, they're very low, and we can't figure out what to do to bring them up, because the adrenals are so important in the whole hormonal profile of keeping a person healthy. So they even are getting hot flashes, and their estrogen and progesterone are okay, and their testosterone is okay, their DHEA could be low, their adrenal glands could be low, and we have no clue until finally we do a stool test and we find, oh my goodness, all of their problems are there. So maybe, can you clarify that and make that point a little stronger for us?
What happens is, again, we always think of stress as something that's emotional. You know, I went through a divorce, I lost my job, I lost everything in my 401k or whatever. But stress can be internal. So what happens, I'll give you an example. I had a patient who came in and exactly what you're talking about. Her cortisol was low, and I really couldn't figure out what was going on. It was low in the morning, it was up in the evening. She was having trouble sleeping. And I did the GI system, I did the GI test, and everything that could be positive was positive. It took us a while to treat her, but that was the only way that we were going to get her cortisol elevated. Again, when you have stress and your GI system is not working properly, not only are you having a problem there, but again, we talk about this malabsorption, and we get so focused on estrogen, progesterone, and all that. If you don't have enough vitamin D because you're not absorbing it, you're not making it properly, then what that is going to do is that will cause a problem with the receptors for the hormones. Your hormones can be okay, but if the receptors are not, if they don't have the right amount of vitamin D and zinc, so even though the hormones are there in the proper amount, if the cells can't recognize it and use it appropriately, it can cause hormone problems. If you have chronic inflammation, that chronic inflammation can cause a problem with the cells that the hormones are supposed to affect. And because they're inflamed, then they can't, even though they see the hormone, they don't respond normally to the hormone because it's overwhelmed with inflammation. We didn't talk much about food allergies. Again, when allergies are able to penetrate, when these substances that shouldn't get in are able to penetrate, you begin to have these food allergies. One of them are gluten allergies, which are very important. We think of gluten allergies as having celiac disease, but that is the end result of a gluten allergy. If you have a gluten allergy and you're constantly eating wheat and breads, you are setting yourself up for this chronic inflammation. And when cells are inflamed, whether they're in the GI tract, whether they're in the breast, the brain, or the uterus, wherever these hormones are supposed to work, this chronic inflammation will cause a problem where the cell can't receive the hormone appropriately. Also, hormones will affect, how hormones work on the brain is that they affect neurotransmitter levels. Well, if the hormone goes to the brain to try and increase neurotransmitters, but there's not enough amino acids to make the neurotransmitters, you can have plenty of hormone around, estrogen and progesterone, and they'll still have hot flashes because it can't effectively communicate the message to the brain because you don't have the building blocks for that message to be carried out. So I know you said something about how the ankle bone is connected to the leg bone is connected to the knee bone, and that's really how we work. If we get to, even in this more holistic type of medicine, if we don't practice it fully, some patients will fool us. Again, we get used to making sure the estrogen and progesterone is okay, and then we make sure that the cortisol is okay, and then we'll have this patient who comes in and befuddles us. That's because there's probably some other layer of that onion that it has this snowball effect that eventually it ends up causing a problem that we associate with hormones, but actually it's a few levels deeper.
Okay, I'm now convinced. You've explained very nicely how important the digestive tract is to our hormonal health, to our total health, so that we don't have inflammation causing heart disease, cancers, all kinds of other illnesses. That the GI tract has got 70% of the immune system. It has to be working properly. There's so many variables that can throw it off in today's day and age, including and most importantly stress and other chemicals. Now I come to the part where I am interested to find out if my patient has a problem in their digestive tract. So what do? I give the patient a slip of paper to go to the community hospital and to have or community laboratory and to have a stool test. And I can tell you from doing that 9 times out of 10, where we're all convinced that we have stomach issues, the results come out, the person is perfectly fine. So what do I do to determine, are there specialized tests? Are there special places? How do you find all of these abnormalities when we send our patients and we're not getting the results that we have a feeling are causing all of our problems?
Yeah, well, what happens is if you send it to a routine lab, you're usually going to do a test for ova and parasites. It's looking for eggs of parasites and actual parasites. Well, unless you have an overwhelming parasitic infestation, you're probably not going to see it under microscopy. You can, but just because you don't see it doesn't mean it's there. There's some specialty labs, diagnostics is one of them that does a complete exam. The other way you can look for exposure to parasites is to look for antibodies to the parasites. The only way you can make an antibody to a parasite is your body would have to have been exposed to that parasite. So if you see that there are antibodies to the parasite and the person has never been treated, the person may benefit for treatment because you may have a smoldering type low-level infestation that's causing low-level inflammation. It's not enough to cause any diarrhea or any significant symptoms, but occasionally a patient will have symptoms. So you can look for antibodies for the parasites, and where you're not going to see it if you just only look at microscopy. The other thing that you look for are these food sensitivities. You can look for antibodies to, and with this is just a cursory one, but you look for antibodies to gliadin, which is gluten, antibodies to milk, soy, and eggs. And you'd be surprised at how many patients will have sensitivities to these. And if you find that you do have a sensitivity to it, it doesn't mean that you can't ever eat these foods, but you need to allow the antibodies to calm down. So you need to avoid the foods for several weeks to months. Allow the GI system to heal so it has a better filter, so now, therefore, it doesn't stimulate this immune reaction. You can also look for what will happen is that they will do cultures. They will put the stool on a culture and allow it to grow and to see if yeast will grow or these abnormal bacteria will grow. This is looking for fungal or bacterial overgrowth. A regular lab may do these cultures, but this is an important part to see if there's any bacterial overgrowth and if there's any fungus in the bowel. And the other thing that you would look for is to look for GI function. How well is the GI functioning? You can look at something called chymotrypsin. Chymotrypsin determines how well your digestive enzymes are being produced, and so would indicate that the patient may need some digestive enzymes. There's 2 other markers that look for gut inflammation. If the GI system is inflamed, then the filter is not going to work very well. So you can see whether the GI system is functioning properly by looking at these 2 markers called alpha anti-chymotrypsin and lysozyme. So you can get a more comprehensive not only of what is affecting the GI system by looking at the parasites. You can see if there's been any exposure to any parasites through the antibodies. You can see whether or not the GI system is functioning properly, and are there some common food sensitivities that may be consistently inflaming the gut and destroying that filter. So you do want to do a more comprehensive type exam and not just look for the parasites under the microscope.
Okay, but this is a more hands-on type of seminar. Where do you send your patient samples to get a reliable test result for all those specialty things that you just said? Because where I send mine, I don't get such good results. Where can I send my patient samples that I'll have reliable, specific results for all these different parts of the examination?
Yeah, I send it to Diagnostics. Diagnostics is a lab in Kent, Washington. It's probably the most comprehensive GI testing that you can get for your patient for a very reasonable cost. And most of these tests, these GI tests, are pretty much this entire panel is covered by Medicare. It's covered by most insurance companies. So it's not so much of a specialty test that the insurance companies don't pay for it. So you would be able to offer this to most of your patients. I'll tell you, any patient who's over 25, 30 years old, they probably have done some damage to their GI system just by eating the standard American diet. And you can also find that even kids will have significant GI dysfunction, primarily due, again, to the fact that our nutrition is very poor. Kids are eating from fast food places and snacks and aren't really eating a very nutritious diet. And with time, it can destroy their GI system and can lead to all kinds of problems. I really think that a lot of childhood obesity is due to the fact that our GI system is being damaged, and so they're really suffering from malnutrition. Even though they're eating a lot of calories, they're not absorbing what the body needs in order to function properly, so they get the fatigue and the weight gain, and it's really a big issue across the board, across all age categories.
Well, I thank you very much for your presentation. I think it's fascinating that a obstetrician gynecologist switched over to away from chemical hormones to give bioidentical hormones, and then branched out further when he realized that he wasn't getting total positive results from just using estrogen and progesterone. So then he went to look at the adrenal glands, and then realizing that something else was bothering the adrenal glands than just stress management or abnormal of the sex hormones, the estrogen, progesterone, testosterone, and DHEA. And then he realized that's the GI tract that's really, in most people, draining our energies, and found a appropriate comprehensive test that complements the entire treatment. That's really what I call a holistic treatment. That's what I call really taking care of the whole person and finding those people that when they leave the office and they leave the treatment will really be healthy. Not just they don't have some hot flashes that we can get by with a little bit of treatment, but really deep down be healthy for the future. So your putting it all together has been helpful not only for me, but for the people watching this and for all the people that will hear about it. So I appreciate your taking your time. Dr. Eldred Taylor, the obstetrician gynecologist, which, by the way, more and more of OBGYNs are using BHRT. And I think that we'll put your book on the website so that people will have a chance to read more details of your approach. And we thank you very much for being with us.
Thank you again for having me. I hope this was helpful, and again, I appreciate the opportunity.